My name is Lisa Sinclair, and I will be discussing my technology application brief for my PAD 747 class. My topic is electronic medical records and the benefits that it brings to the medical environment. I'm going to start by giving a brief introduction on exactly what is electronic medical records. It's basically a way to document patients' medical records by using computer software which allows providers to store patients' records more quickly and transfer them to other providers as needed in a faster time frame. Unlike traditional record keeping, actually, which was done with paper and pen and physically filing in the cabinet, um, traditionally physicians have spent a significant amount of time with paper records that are bulky and takes up valuable space in their practice environment. Filing, retrieval of files, and refiling of paper records are labor-intensive methods of storing patients' information. And in the hospital setting, based on my research, when a record is checked out from one department to another, um, department cannot basically, it's not easy to basically access the charts of the patient. The impact of not having immediate way to key information in emergency situations can be extremely serious. Um, now I'm going to really discuss policies about electronic medical records. The economic stimulus package that was passed on February 2009, known as American Recovery and Reinvestment Act, has an EMR incentive that is built to foster meaningful use by healthcare providers. This is called the Health Information Technology for Economic and Clinical Health Act. The EMR stimulus was put in place to encourage health centers and office-based physicians to quickly meet its objectives. Providers who go ahead and use EMR, implement EMR into their practice or into their hospitals that meet certain requirements are qualified for government grants. Based on my research, I have noticed numerous benefits that keep recurring when you use EMR. Some of the benefits that really sticks out to me is that it can help maximize physicians and medical institutions' productivity. Another benefit is that it's eco-friendly, and another one is that it helps limit malpractice, and it gives patients basically an active role. It allows them to play an active role in their healthcare. EMR system makes the most physicians' output by naturally organizing the enormous and complex nature of healthcare systems in one computer-based database. Um, it's easy to get to via the simple click of a button. Um, by spending less time tracking charts, staff can update provider and patient contact time. As a result, physicians may spend more time with individual patients as well as increase the number of patients they see in one day. EMR offer the potential benefits of increased revenue by allowing an increase in service per visit and patient volume, as well as providing fully documented coding recommendations required by many insurance companies for reimbursement of services. The next benefit that EMR provides, which is possibly the most attractive benefit in my eyes, is that it has the ability to lower physicians' risk and reduce errors through medication alerts concerning drug connections and allergies by making possible communication among healthcare providers by providing computerized physicians' orders entry to eliminate errors due to legibility issues and by improving medical record documentation. Because EMR software incorporates clinical decisions support, it can aid in diagnosis, alert the physicians of prescription drug interactions, and advise treatment plan recommendations. In the case of e-prescriptions, the EMR automatically screens for drug interactions, dosage, and patient-specific medication factors. When a medication listed in an EMR matches medication in an FDA safety alert, patients taking the medications are flagged, which is reassuring to me, which as a patient makes me feel comfortable. Um, Another EMR benefit that I find to be exciting is that it's eco-friendly, um, and that many large electronic medical record systems firms such as QMD, NextGen, and Epic Care are developing electronic medical record system with paper-free services like electronic medical billing, business process outsourcing, and online registration of patients. Online registrations of patients' online data, compli- compilation, and electronic entry by physicians. Um, Together with these solutions, a popular recent innovation of EMR system is the use of web-accessible patient records. With the arrival of this important part, the healthcare facility becomes available nearly anywhere. Um, Another benefit that is extremely important is that with EMR, the patient's medical data, including demographic and insurance information, as well as listings of diagnosis, medications, allergies, immunizations, and other various important medical information are exactly and concisely organized. Using standardized terminology, results of laboratory tests and x-rays done in the office or at the hospital can be immediately added to the record. These results can be graphed and viewed in a number of meaningful forms. Electronic medical record system firms are working, based on my research, is working on results being rapidly passed on to the patients through a secure internet gateway or portal that links a patient to the physician's office. The patient will be able to update his or her personal and health insurance information easily and will not be required to complete the same forms each time he or she visits the physician's office. Prescriptions are electronically sent directly to pharmacies and are ready to be picked up after the office visit. In conclusion, electronic medical records offer many benefits to primary care physicians as well as their patients. The use of this technology increases more patients. The use of this technology increases more patients' willing benefits by spending less time in the physician's office and having their medical records accurately shared.